Hi everyone, welcome to Evolve 101 Health Talks with Dr. Inaka Yembe. This video is the third video of a 5-part series on diabetes, and today we'll be talking about the treatment, nutrition, and self-management of diabetes. You know, one of the biggest myths that I hear from my patients is when you diagnose someone with diabetes, then they are surprised and they don't believe you because they tell you, well, I have no symptoms, so I cannot have diabetes. You can have diabetes without any symptoms. In fact, most of the patients that we diagnose incidentally, meaning that they come in and they get blood tests for other reasons, they have no symptoms. If you missed the previous video number 2, talking about the symptoms of diabetes, look in the chat box because I have the link there below for you. But anyway, now that you have become diabetic, it's important for you to do certain things and to know certain things because, as the saying goes, when you know better, you do better. So there are 2 phases of diabetes treatment. Today we'll be talking about the treatment. What you can do to help yourself when you're diabetic and what your doctor does to help you. Now, I am not going to go into detail about what your doctor does. Just from that point of view, your doctor may prescribe you medicines. Medicines may come in tablets, so pills that you have to take. Please make sure you take your medicines as prescribed. It's very important. Another type of medicine may come in injections, in shots, so insulin, and other medicines can be given to you in injection format. Again, please make sure you take all medicines as prescribed by your doctor. Now, what can you do to help yourself now that you're diabetic? Number 1 is knowledge. Knowledge. Why did you become diabetic? The hallmark of diabetes is elevated blood sugars. Something happened, either you had symptoms or you had a test and you were diagnosed with diabetes because your blood sugars are high. So you want to become very knowledgeable and consistent, meaning that you must know and you have to do things every single day to lower to keep your blood sugar low. So number 1, nutrition is key. What you eat and what you drink is very important. So let's talk about the things that we need to avoid now that we know we are diabetic, because your medicines will not work as well as they should if you don't fix your nutrition at home. So there's no point going and taking your medicines and not doing the right things or not eating the right things and not avoiding those foods that can cause us problems. Problem foods are the ones that are high in carbohydrate. So the starchy foods, fufu corn, fufu yam, gari, cocoyam, potatoes, cassava. All those foods are high in starches. Also things like bread, biscuits, puff, amizgay, anything that you know is high in carbohydrates, donuts, chin, all those things are too high in carbohydrates, so you want to avoid them. So when I talk to patients like this, they say, oh my goodness, what do I need to be eating then? So let me give you some options. Anything that is a vegetable, so njama, all kinds of jamas are fine. Just try not to put too much oil. If you want to put a little bit of egusi, crayfish, just a little bit, that's fine. But focus on eating more vegetables. If you like salads, those are good. If you like to eat soup, like okra soup, pepper soup, that's good for you. Other soups that you want to be very careful with are things like achu soup, just because of the oil, and the oil can make us to have problems and cause us eventually to have heart attacks if we eat just too much oil. So achu soup, I try not to eat that too much. On the other hand, you can eat nkui, you can eat black soup. Those kinds of soups are fine. Now, you can also eat roasted fish, roasted meat. Don't eat too much meat. Chicken and fish, those are very good for you. You can eat a little bit of green plantain, not the ripe plantain that's fried, not dodo, because dodo is sweeter, has more sugar, and when you fry it, it has more oil, not good for you. If you want to eat eggs, that's okay. Try not to eat more than 2-3 eggs at the most per week. And fried egg, if you're frying your eggs, just once a week. Otherwise, you should boil your eggs. Boiled egg is healthier because no oil. So the way you eat is the most important way to keep your blood sugars under control. Another thing that you want to start working on is your weight. If you are heavier and you know that your weight is too much, your doctor told you that your weight is too much, and you yourself, you feel and know that your weight is too much, you want to start reducing your weight. How do you do that? Eat less. The older we are, the less we need to eat. I am 53 years old almost. In 2 weeks, I will be 53. I can no longer eat the same amount of food that I used to eat when I was 20. When you're younger, you can use or burn off your calories faster, but you have to eat less. So eat everything in moderation. Cut down on the amount of foods that you are eating as you get older. If you are 70 years old, you even need to eat a lot less. The older we are, the less we need to eat. Also, things like fruit. I want to talk about fruit because most people know that fruits are healthier. That's true. Fruit is good for you. But when you are diabetic, don't eat too much fruit because that sweetness, the kind of sweetness in fruit is caused by fructose, and that is just sugar. It's the kind of sugar that is found in fruit. So if you are diabetic, cut back or try to avoid things like oranges, things like bananas, pineapple, those mangoes. Those have too much sugar for you whose blood sugar is high. So you're back to your vegetables. Eat vegetables, eat proteins, eat soup, and those will keep your blood sugars lower. If you want to eat nkui, that's fine, but drinks like sha, palm wine, beer, sodas like pamplemousse, Fanta, Coke, those have too much sugar. You want to stay away from those. What's the next kind of behavior that we need to adopt is exercise. If you're walking to the farm every day, good. But if you're the one to get up in the morning, stop the taxi, drive to work, then you want to start exercising. It's important for you to exercise 30 minutes at least 5 times a week. So that is 150 minutes per week. Exercise is very important. Next thing I like to talk about is alcohol. Beer, wine, all those alcoholic drinks have what we call empty sugar. Some people will drink wine, a bottle of wine. Diabetics should not be drinking wine because they have too much sugar. Then the last thing I'll talk about is smoking. Smoking should be stopped. Why? Because diabetes already puts you at risk of having heart attacks and stroke. If you smoke, then your risk of having heart attack and stroke is even higher. Now, lastly, I'll talk about knowledge. If there's a way for you to know your numbers, for you to know your A, B, C's of diabetes, that's what we call it. So A is your hemoglobin A1C. Hemoglobin A1C, that's a number your doctor checks once every 3 to 6 months, depending on what the last value was. We try to keep it to less than 6.5 or less than 7% based on what your doctor tells you. Some people have to have it checked just once a year, even because their diabetes is well controlled. But you should know your A1C. That's the A of diabetes. The B of diabetes is your blood pressure. If you have high blood pressure and diabetes, you have increased risk of having heart attacks and strokes. So again, if you're diabetic, your blood pressure, should be less than 130/80. Make sure you check your blood pressure. So if your doctor says come back in a month, please obey your doctor and go back and get your blood pressure checked, because you have increased risk of major medical complications because of diabetes and hypertension if you have both of them together. The last part of this ABC is your cholesterol. Again, people who have diabetes and high cholesterol are at increased risk of having major medical complications like heart attacks and strokes. So your bad cholesterol, which your doctor checks on a blood test, your bad cholesterol should be less than 100. And for men, your good cholesterol should be greater than 40. For women, your good cholesterol should be greater than 50. All these things are just numbers that your doctor checks. But from your part, if you don't have a way to have all these numbers checked, remember what you eat and what you drink is important. Take all your medicines as they are prescribed. Show up for your visits. And if you start having symptoms, please don't postpone serious symptoms like chest pain. Chest pain from a heart attack could feel like any sensation that occurs from the base of your neck to the top of your stomach, from your right arm to your left arm. Anything that happens in your chest, like it's just uncomfortable, I don't feel it well, it's tight, it feels like something sitting on my chest, it feels like something squeezing on the inside, it feels like I cannot breathe, it feels like my heart is racing, it feels like I can't really describe it, it just feels so bad on the inside. Those could be symptoms of a heart attack, and I need you to go to the hospital quickly. Don't go home and sit down and wait for the symptoms to pass. Yes, the truth is some of the symptoms of a true heart attack will pass, but the damage is still there. And then what happens is you can have another one, and this time could be the big one, and that's how we have unfortunate catastrophic events like loss of life, or we have paralysis, or we have long-term chronic problems, because the fact is, if you have too many little heart attacks, your heart can fail now, and then you just have problems. Other things like leg swelling or numbness in the legs. If you are not checking your blood sugars, you start having numbness, or you have pins and needles that occur or happen in your fingers that are keeping you awake. It feels like you can't feel. Something is wrong with your fingertips or your toes. Then go immediately and get your blood sugar checked if you cannot check it at home. Another way that you may know that your diabetes is not under control, if you don't have a way to check it, is, let's say you have a wound on your leg, or a wound shows up and you don't know how it got there. Or let's say you actually had a cut, you were coming from the farm and you accidentally cut yourself, and that doesn't get well, it doesn't get well for some time. Go and get it checked, because diabetics have difficulty with wound healing. Poor wound healing is one of those things that happens when we have diabetes and our blood sugars are high and uncontrolled for some time. So I hope this information helps you. Listen, if you have any questions, please put those in the chat box, and I'll be happy to answer your questions in the last part of this video series, in video number 5. If you are not subscribed to my YouTube channel, please head over to Dr. Inaka Yembe TV. Hit that subscribe button and the notification bell, so each time I put up a video like this, you get a notification and you can get some information that would help you live healthier. Again, all the information that I give you is never a substitute for your doctor's advice. Thank you.